Hello dear friends, welcome to my channel. Thank you so much for your love and support which you have shown all these days. So yesterday I have reached 1000 subscribers. Thank you so much for your support. And today we are going to discuss about the dissection of axilla. As the topic is vast, I just want to make it into three different parts and discuss about the dissection of axilla. So in this part I am going to discuss about axillary artery and its branches. So let's get started. Before going to explore this video, please subscribe to my channel. So axillary artery and its branches. So first, as in our previous dissection, we have dissected the pectoral region, and now we are going to see the axilla. What is axilla means? It is a armpit in our general terms we call it as, and it is a four-sided depression, four-sided pyramid. It is a four-sided pyramid, and apex is projecting upwards and medially, and base is formed by the skin, superficial fascia, and the deep fascia called as axillary fascia. So here you can identify when the depression is very prominent when the arm is abducted. When the arm is abducted, you can identify the deep depression. When the arm is adduction, in the position of adduction, this armpit is not such a prominent thing. So let's get started how we'll give incisions in the pectoral region. So here you can identify. So there's a vertical incision from the jugular notch to the epigastric fossa. Then the second incision we are giving from the suprasternal notch to the lateral border of acromion process, and also it is extending up to the arm till at the insertion of the deltoid muscle. Then the third incision which we are going to give from the epigastric fossa to the midpoint of the axilla, and we are not dissecting the nipple in the case of male. Actually, in the case of female, as we can dissect the breast gland so that we can see all the lactiferous ducts, lactiferous sinus, and the nipple also lactiferous sinus area that we are going to see in the dissection of the breast. And the next incision is from the epigastric fossa to the lateral border, means at the mid-axillary line. So we are going to give incisions from the epigastric fossa at the level of mid-axillary line, from this epigastric fossa to the mid-axillary plane. Okay, so that is about the incisions. So we are going to reflect the skin. How to reflect the skin is we need to take the toothed forceps. Small part of the skin has to be reflected, and slowly we have to reflect the skin flap. So remember, when you are removing the skin flap, the scalpel handle should be in your under your control, index finger control, and entire sharp end should be projecting upwards, okay, towards this reflected skin flap that should be there, so that we cannot disturb any structures which are present underneath the skin or below the skin. So remember this point here, friends. So whenever you are reflecting the skin flap, the sharp end should be present towards the reflected skin flap. In such a way we have to reflect the skin. Then after removal of the skin flap, we can identify the superficial fascia and the pectoral fascia. And we have removed the pectoral fascia and superficial fascia. Then we can identify the pectoralis major over here. And this is the pectoralis major. This is the pectoralis major. How to cut the pectoralis major? I already have discussed in the pectoral region dissection. So we are going to separate the pectoralis major, clavicular fibers, then sternocostal fibers, and the aponeurotic fibers. We have to dissect and reflect it upwards and laterally. Then underneath it we can identify the pectoralis minor, which is arising from the third, fourth, fifth ribs. Then at the superior border of the pectoralis minor, where we can identify the pectoralis minor is covered by the clavipectoral fascia, the deep fascia. So the deep fascia will be covering the pectoralis minor and also above the subclavius muscle. So when you are reflecting the pectoralis major, just beneath the pectoralis major, we can identify the clavipectoral fascia. So at the superior border of the pectoralis minor, we can identify the clavipectoral fascia is pierced by a nerve called as lateral pectoral nerve. Lateral pectoral nerve. And also this pectoralis minor is pierced by the medial pectoral nerve in such a way. So the medial pectoral nerve is piercing the clavipectoral fascia, pectoralis minor, and then it is coming outside and supplying to the pectoralis major. So in this process, this medial pectoral nerve is supplying to the pectoralis minor and the pectoralis major. And the lateral pectoral nerve is piercing the clavipectoral fascia and coming outside and supplies to the major. In this process, it is also supplies to the minor. Okay, so that you have to remember. Then another artery called as thoracoacromial artery. Thoracoacromial artery. Strictly speaking, the pectoral branch of thoracoacromial artery, which is piercing that and coming outside and supplying to the pectoralis major and the pectoralis minor. So let me show you. Here you can identify the pectoralis minor. So we have separated the pectoralis major. Then underneath the pectoralis major, as I told you earlier, thoracoacromial artery and vein, and also the lateral pectoral nerve we can identify. The nerve which is piercing the pectoralis minor, that is nothing but the medial pectoral nerve. Okay, just remember these terms. So from where this medial pectoral nerve, lateral pectoral nerves are coming, I will discuss in the next class. And here you can identify the medial pectoral, and this is the lateral pectoral nerve. Now after separating the pectoralis minor from the at the origin, so from the third, fourth, fifth ribs, we have to separate the pectoralis minor and reflect it upwards and laterally. So then what we can understand, what we can see is underneath it we can identify the veins and also the axillary artery. So the axillary artery is subdivided into three parts by this pectoralis minor. So the part which is present above the pectoralis minor, that is called as the first part. Then second part which is present under the pectoralis minor, that is called as second part, the hidden part. At the lower border of the pectoralis minor, which is extending downwards, that is called as third part of the axillary artery. So you need to remember, axillary artery is divided into three parts by this pectoralis minor. So that is about the axillary artery and its branches I am going to explain in the next part, upcoming slide. So before going to see that, so we have given incision up to the midpoint of the axilla. Then after that we have to separate the skin where we can identify the floor or base of the axilla, where we can identify at the base we can identify axillary pad of fat. Here we can identify axillary pad of fat. So in the pectoral region dissection we have seen pectoralis major, minor. Underneath this pectoralis major and minor we have seen all these nerves and vessels. Now after separating the skin at the axilla, immediately we can identify this yellow color structure which is called as axillary pad of fat, and sometimes you may identify the lymph nodes also. So here you can identify the skin flap. Since skin has been removed at the axilla, where we can identify axillary pad of fat. Here you can identify the skin. In the superficial fascia we can identify axillary pad of fat. So underneath it the axillary artery, axillary vein, both are covered by the deep fascia. This is a deep fascia modification called as axillary sheet, which is covering the axillary artery, axillary vein, and some nerves are also covered by this sheet. So we need to separate this axillary sheet. We need to separate this axillary sheet in order to see the axillary artery and its branches. So after that, here we can identify there is a nerve which is coming from the thoracic cage. That is nothing but the intercostobrachial nerve. You don't need to worry about it. I will explain where it is going and how it is entering into the arm. As the name says that it is intercostobrachial. Intercosto means the ribs. It is coming from the intercostal space, and the brachial means the arm. Then here you can see the axillary sheet. So sometimes you may identify the lymph nodes in the axilla. If any infection is present in any cancer conditions, you may see some lymph nodes over there. They are called as axillary group of lymph nodes that I am going to discuss in the upcoming class. These are the axillary group of lymph nodes. Then we have separated the skin, superficial fascia, even axillary sheet also we have separated. So what we can identify are the blue color structure is nothing but the axillary vein, and some tributaries we can identify, and also we can identify some nerves. So what are the nerves? So I have shown you the two nerves. One is medial pectoral nerve, which is piercing the minor at the superior border of the pectoralis minor, that I have told you about. It is lateral pectoral nerve. So what are the other nerves? I will explain in the next class. In this class, I am going to show you the arteries only. So this is the axillary vein. Then what in this after separating this axillary vein, you have to hold this axillary vein with the blunt forceps, pull it towards medially, where we can identify axillary artery clearly. This is nothing but the axillary artery. Okay, so this is the axillary artery. Then the branches of the axillary artery, how to identify the axillary artery. So this axillary artery, which is having the branches called as, from the first part, one is superior thoracic artery, that I'm going to show in the next slide, and then from the second part, two branches. So I told you three parts are there. Axillary artery, first part is present above the pectoralis minor, second part is present under the pectoralis minor, third part is present below this pectoralis minor, means from the inferior border of the pectoralis minor, that is called as third part of the axillary artery. So in this slide I am showing you from the second part of axillary artery, there are two arteries are coming. One is thoracoacromial artery, then lateral thoracic artery. So this thoracoacromial artery, it is having four branches. So the four branches are pectoral branch, acromion branch, deltoid branch, and then clavicular branch. So remember the acromion branch, deltoid branch, deltoid branch, and also the clavicular branch. Both three arteries, they are running upwards and laterally. So the deltoid branch, which I have shown you in the deltopectoral triangle, that class which is available in our YouTube channel, you can see that. Okay, in the deltopectoral triangle, where we can identify the deltoid branch of thoracoacromial artery over there. So the acromial artery, which is running towards the acromion process, and the deltoid branch, which is running towards the deltoid muscle. Okay, so the deltoid branch, which I have shown you in the deltopectoral triangle, and then the pectoral branch, which we can identify under the pectoralis minor, and is piercing that and is coming outside, and is also supplying to the major and minor. So that is about the pectoral branch of thoracoacromial artery, which it is running along with the medial pectoral nerve, where we can identify here. Then the lateral thoracic artery, which is running downwards and lateral to this thoracic cage. So how to find out this arteries is, it is skillful. You need to take the blunt forceps and clear all the fat. You have to hold it at one particular part and remove all the fat. So it may perhaps take some time, but take some time and try to clear all the fat. You better not to use any scalpel over here. If you use scalpel, you are going to cut all the nerves, vessels and all. So better not to use any scalpel or tooth forceps. Even pointed forceps is advisable, but it is you can use, if you have a skill, you can use that pointed forceps also, but better not to use that. You can take the blunt forceps and clear all the fat, so that you can find out all the arteries, veins and nerves. So that is how we have to see the pectoral branch of thoracoacromial artery and the lateral thoracic artery, which is running downwards towards the thoracic cage, lateral part of the thoracic cage. That artery is nothing but the lateral thoracic artery. Then at the upper border of the pectoralis minor, I told you about the first part. From the first part, which we can identify the superior thoracic artery. So in order to see that, I have removed the axillary vein over here. So that I can identify clearly the superior thoracic artery. That's why I have discussed about the superior thoracic artery after explained about the second part of axillary artery. Okay, so that is about the superior thoracic artery, which is a branch of first part of axillary artery. Then the third part, let us discuss about the third. So from the third part of the axillary artery, there are three branches are coming. One is subscapular artery. So try to find out. Lateral thoracic artery will be running downwards and lateral to this thoracic cage, whereas the subscapular artery, which is running downwards and laterally, and it is going posteriorly, so that is about the subscapular artery. So this subscapular artery, which is going to give a branch called as circumflex scapular artery, that we are going to see in the dissection of the scapular muscles, in the next class. Okay, so that is about the subscapular artery, which is a branch of third part of axillary artery. Then we can identify two other arteries called as anterior and posterior circumflex humeral artery. So this is called as anterior circumflex humeral artery, and this is the posterior circumflex humeral artery. So this posterior circumflex humeral artery, which is running downwards, and it is running laterally and encircling the surgical neck of the scapula, surgical neck of the humerus. So this posterior circumflex humeral artery, which is running laterally and encircling the surgical neck of the humerus along with the axillary nerve. So I am going to discuss about this axillary nerve and all these nerves in the next class. Then you will understand how to identify also. Okay, so how to identify, you have to after removal of this axillary vein, then after finding this axillary artery, you better to take a blunt forceps, hold the axillary artery and pull towards the body, so that we can identify the two arteries, anterior circumflex humeral artery and the posterior circumflex humeral artery. We need to hold this axillary artery and just lift it upwards and towards the humerus, where we can identify subscapular artery. Okay, subscapular artery, which is a branch of third part of axillary artery only, as it is running posteriorly. If you hold this axillary artery and pull towards the humerus, where we can identify the subscapular artery. If you hold the axillary artery and pull towards the body, where we can identify two arteries called as anterior and the posterior circumflex humeral arteries. So that is about the axillary artery and its branches, my dear friends. So see you soon with a new class. In the next class, I'm going to discuss about the brachial plexus, and I will explain you how to identify each and every nerve. Thank you, dear friends. See you soon with a new class.